Do you think, uh, do you think external factors such as food, stress, play any role with HD?
So I think that they play a role with any brain disorder. And exercise is the biggest one that we talk about because there's more and more evidence in all different diseases that impact the brain that exercise has benefit to the brain. We know that good nutrition kind of provides a good environment for nerves to sustain and hopefully to heal. So we know people with diabetes, for example, if that's out of control, then their nerves start to struggle and die off in their feet. Okay, they get neuropathy. But if you can control your diabetes and have good diet, then it can regrow. So I think diet in many neurological diseases does have an impact. Something like sleep is a basic function that we all ignore, including me. I'm guilty of it as well. But you know, when we're hungry, we eat. When we're thirsty, we drink. When we're asleep, I think I'll look at my emails for a little bit longer and then go to bed, right? So we ignore the sleep that we really need, and I think that has a big impact on function as well, cognitive function. So whether it's Huntington's disease or other diseases of the brain, I think we need to take care of ourselves in terms of our basic functions in those ways as well.
Is all Huntington the same, or is it individual?
In terms of the disease itself,
Yes.
very individual. And that's within families as well. It is remarkably individual. One drug might work for one patient, won't work for another, and vice versa. Some people have problems with weight, whereas other weight loss usually, whereas others don't. Some people have onset and they're in their 20s, and then in the same family it may be earlier or later. So it's a completely individual disease, and every person needs to be treated differently.
So these trials aren't for everybody?
That's a really good question because there are specific entry criteria. And so not everybody can participate. And I think one of the objective things is this, right? If you don't have one of these SNPs, you can't participate. But let's say you have had severe back problems and back surgery and you can't have a lumbar puncture, then these interventions may not be for you. They may also be looking for people at specific stages of disease, so maybe gene positive and a few subtle signs but not much else. So if you're pretty severe in terms of your disease, you may not qualify for this because we may not see much change. So that's they're set up, the inclusion and exclusion criteria are set up so that people stay about so that we can look at the intervention, right? So if people are adding medications left and right, and there's a new intervention that we're throwing in there, and they have a side effect, was it from the new medicine that we're testing, or was it a side effect from the medicine that they took too much Benadryl and they weren't supposed to take that kind of a thing? So keeping all factors the same in someone as much as possible and adding in a drug and seeing what the effect is really the idea behind all clinical trials. So we want people to be, in some ways, the same for certain criteria so we can look at what the drug itself does, both in terms of the good and the bad. Yeah.
So out of the 46,
Yes.
so what was the criteria?
I wasn't directly involved with this clinical trial, but I know that they obviously had to have an expanded CAG repeat, and I don't know if they were either early symptomatic or not yet symptomatic, but I know it was early in the course of the disease.
That's pretty much what they alluded to.
Yeah, most of the trials are going to be that. People that are relatively early in the course, or what we call prodromal, so they don't necessarily, can't say for sure that it's definitely the onset of Huntington's disease, but they have some subtle stuff that might be, and in retrospect, it might have been. So people that have some subtle things, or early onset of the disease, early stages of the disease, I should say. Yeah.
So logistically, I guess if people are thinking about testing and then enrolling in the HD online, like you would do the testing first and then do the enroll HD and that kind of thing.
So that has to be, those are two different things. right?
Mhm.
So, clinical care is very different than participation in clinical research. The goals are different. If you wanna know what your CAG repeat length is, for you, that's clinical care, right? So that's going through genetic testing, meaning social work, having the blood drawn, and hearing the result. You can participate in Enroll HD as someone who's at risk. It will not tell you what your CAG repeat length is, but it will be done. But that's for research purposes. It's not for your own personal clinical purposes. It's for the greater good to answer a scientific question rather than focusing on you as an individual to address your needs. So people confuse it all the time. It even has a name called therapeutic misconception, where people either participate in research thinking they're getting clinical care, or they participate in research thinking that they're going to get more benefit than is actually anticipated. All right, well, I will